solutions. The solutions lie in three areas. The first one is the provider. So as a provider, you need to be culturally sensitive and culturally aware, like we have been saying all this session, that people are different, and being different is not being weird, and is not being rude. People do whatever they know best how to do. So take your cues from them and treat them like they want to be treated, not like the way you want to be treated, like they want to be treated. Take your cues from them. So if they don't keep complete eye contact, do the primary eye contact and then go on. Greet them at the door or on your desk. Like I said, pase, use buenos dias, buenas tardes. Just few words in Spanish will go a long way. 2 or 3 words in Spanish that you just can remember, and it will go a long way so they will feel welcome. Inquire how they want to be addressed. Like we said, you say señor or señora and their last name. And then ask them how they want to be called. Don't start by calling them by their first name, because informality is rudeness for the Latino community, especially if they are elder and you are a younger healthcare provider. Ask them how they want the information. Some people would want it like in tests, in written, in pictures, and who they want to be involved in their solutions, or who they want to be involved in their decisions. Is there a certain person in family that you need to share the decision first before with them? And of course there are forms to be signed and all that because of all the HIPAA rules and all that and privacy issues. You need to respect them, and again we said that the patients is personalismo, conciencia, which is being personal, being kind, being trustworthy, and show them that you care. The second thing that we need to put in consideration is our own bias and prejudice. Again, no matter how open-minded we are, we still have a little bit of bias and prejudice inside of us, and we need to become aware of it so we can at least kind of balance it or neutralize it. So there are some healthcare providers, again, none in the room here, I'm just saying that usually they have bias or prejudice against people that speak Spanish and they don't speak English, especially if they have been here for a few years, or if they have a heavy accent of Spanish. Or there is not a lot of bilingual materials. It's becoming more and more, you can find more and more now bilingual materials that helps a lot, especially if it has pictures, because like we said before, not all Latino patients even read Spanish. So, we need to be kind of delicate around that area, especially like Mr. Gasson said, that if they will tell you, they return the form to you without being filled because they don't know how to read it. Or if they tell you, like we said, I need to get my glasses, I can see very well. So, assuming there are a lot of, like we said, a lot of healthcare providers that will look at a Hispanic and they will just assume they are illegal, which is not always the case. And don't use medical terminology if you are a healthcare provider. Just try to use as simple words as possible, because even people that have English as their first language, if you use medical terms, they will not get it. Like if you start, like I said, with nephritis, if you appendicitis, if you start with even bipolar, the term people are not familiar with it. All these terms, medical terms, you are not going to be able to communicate properly with the patient. So use simple English. And then the provider self-awareness. As healthcare providers, we need to know what is our culture, what are our values, and how they influence our understanding of other people's cultures. Are we accepting differences or not? Are we seeing these differences, or are we colorblind, or are we just in the way, I know I am a healthcare provider, I'm in this industry, or I'm in this profession because I know better, and they should listen to me. And if they don't, it's their loss. This is an attitude that we can see sometimes, and we are all in this profession because we care about other people. And again, it becomes very simple in the beginning, simple steps to show, like we went through this session, to take them step by step. It will take a little bit time of the first or second visit, but after that, you will have all their dedication, all their trust, their confianza, and they will deal with you, and you will have great results after that. When rendering culturally competent care, you need to be aware, like I said, about your own value, how you are perceived. Are you really expending all of yourself, and are you really accepting the people for who they are? It's great to have trained professionals around you, especially if they speak different languages, especially around you. Like we said, professionally trained interpreters. Don't use someone from the sitting room, the children, or a janitor.